I'm not going to talk about Smartline itself because we've got quite a few academics and a couple of my staff here who can talk about that in more detail. I'm going to give you an overview of the work that the voluntary sector does on social capital. If anyone is aware of what social capital is, there's different types of it. The two fundamental ones are bridging and bonding, but we'll go into that a bit later on. And the voluntary sector have been sort of working in this agenda for a long time. And what I see over the last 5 years, I think we've made more progress with the public sector in the last 5 years than the previous 50 in many respects. So when you have a look at a person's... Sorry, it's gone there. I want to get another slide before that one. Right, so we have always engaged people, not as patients, not as the kidneys in bed 4 or the liver in bed 5. So, because people are manifold, people have got all sorts of issues. And that, I think that has now taken traction in the public sector, particularly health and care as well. So we stopped talking about, and Tracy from Age UK, though we've been going on with for a long time. So we don't talk about patients, we talk about people. And the person is at the centre of the discussion, and all the issues around that person is at the centre. And I know we've got at least one GP here, Ian. I can see one, at least one. Might have some more. And we're working with the general practice and primary care networks, which is a development of different approach at a locality level. And we say primary care is not GPs. Primary care starts with the person, the family, and the community. Then you have you have the GPs in interventions. So that's the way we work. I've got to go back again now because the slide's in the wrong order. So the person in terms of health and care, they've got physical, emotional, and they've got immune issues to address. And all of that is influenced by the environment. So Smartline is looking at the environment from the house and the place they live in. But all of those have an influence from the environment which they live. So you've got the macro-environment, then you have the meso-environment. Historically, the interventions from health and care have always been quite narrow. They've always been about an issue or a condition. So therefore, you don't really look at the context of that person or the other issues around that person. Because you have other parts of a meso system. You've got the family, peers and friends. And even they interact to influence the person you're trying to do. So that is not a machine. This is a complex system, not an engineered system. So where we have very mechanistic approaches to someone's well-being, it just doesn't work. I think Ackoff said it, I think in 1993. The characteristic way of management that we have been taught in the Western world is to take a complex system, divide it into its parts, and then try to manage each part as well as in a box. And if that's done, the system as a whole behave well. This is absolutely false, because you improve one part of the system, but not everything. The other part of the system, you've got the expo system, is sort of one bit removed, and that's like the work where you work. So there's a lot of discussion about age and how you look after your ageing parents. But where you've got fragmented families, it's very difficult to do. For instance, in Japan, if you live in Tokyo and your parents live in Hiroshima, you can volunteer to support older people in Tokyo, and someone will do likewise in Hiroshima. So it's quite an interesting model. So move on from that one. Talk about the complexity of it. We always try to simplify everything. And if those who are engineers here, builders, of course you do. And if you've got something, if you do build something, the more you build it, the better you get at it. As it becomes more complicated, then you bring in your experts. So if you're building a building, you've got quantity surveyors, you've got your bricklayers, etc. We don't live in a world like that. A community is not like a building. It is more complex than that. The chaotic zone is not disorder. Chaos, if you're scientists, understand it's not disorder. It's something quite distinct from disorder. And sometimes chaos can be quite creative. Something will emerge from that chaos. And sometimes politicians like things in chaos because something will emerge where there's good or bad, it's uncertainty. The voluntary sector sort of work in the complex arena. We understand that any intervention we have within a community has unintended consequences, or you identify adjacent possibilities, and that is all emergent. So you don't go into a community, and this is what we do with Smartline, you don't go into a community with preconceived ideas what will happen or what's good. Too often when we have Prince 2 project management, we're going to start on this day, we're going to do this, this, this and this, and then something wonderful will happen at the end. Well, generally it doesn't. So the other part of it is I'm not sure if Dr. Katrina Wyatt's in here. She's one of the team. She's in tomorrow. If she was here, she'd recognise this. This is something I did with her 15 years ago. It looks at the challenge we have working in communities. And it is dynamic, it is complex. You can't have it as a machine. There's generally no strategic direction about how you engage communities. Each organisation or each discipline will work in its own way without understanding the consequences of the interactions of that. Again, the voluntary sector try to work from the context of the person and the interactions from it, although that is very difficult because the way we work with people and communities is driven by competition, and competition when you're working in a social arena can be very damaging because people put the walls around themselves and said, I'm not talking to you because you do that and I'll do that. So actually you do a disservice to the people and your community. So it is a challenging environment to work in. So just going back to the core of social capital, so total capital is underpinned by the norms and values of your communities. Those disadvantaged communities, and I was from one many years ago in Liverpool, people don't wander around thinking, I'm disadvantaged. They just cope with what's around them. But your norms and values not necessarily what are the norms and values of a wider community. So you've got to be aware of that when you're looking at behaviour and issues, because it has real benefit if you take that social capital, address some of the norms and values. You get a manifold outcomes from it. Again, when you look at the amount, I did economic development all over the world once upon a time. The amount of money we spend on economic development is huge. The amount of money we spend on social capital development is minuscule. You used to do it in school once upon a time. You not necessarily do that anymore either, because I think it was Tony Blair said it once. The schools are our best economic tool we have. Well, I think knowledge and education is a bit more than an economic tool. So we have a huge amount of community assets in across Cornwall, and they're worth a huge value. So that you've got knowledge, your skills, and again, going back to what we're doing within Smartline, it's understanding what is there. Sometimes you don't tap into it. Sometimes you see the gaps. Sometimes, actually, you might talk to someone and they might have an idea about something else. And then it's how you evolve that. We did some work in Cornwall Downs a couple of years ago where we got health and the GP practice to work with the community and health. Because, we've done it. Now they're working together. As soon as you do something in a community, something will happen, whether it's good or bad. Well, 3 months later, they all fell out. So you've got to, it's not something that is static, so you've got to be reiterating all the time. You've got to, and sometimes, in the public sector, not very good at that, you've got to say to someone, no. I was president of a chairman of a residents group in Truro, where we had one woman who basically destroyed the residents group, because the housing association at the time said, well, we've got to be inclusive, we have to involve her. And I said, but everyone else is walking away. No, we can't do anything about that. The whole thing was destroyed. So sometimes you've got to say to people, no, you can't. And one of the frustrating things for the sector is that we've been talking to generally about these issues for a long time. And, we're too busy to do this, too busy to do that. So, sometimes we can improve things. And as I said before, I think the last 3 or 4 years, we've probably made more progress understanding the value of what communities can do for themselves than the previous, I think, 20. This is, you're probably not sure you can see it all, but this is Andy Haldane, who's the Chief Economist for the Bank of England. He's a real supporter of social capital and what the communities do. If you have a look at this, if I could just get the figures on here. If you just look at what charities spend in the UK, the value of GDP in charities, GDP is not why we have a charity, by the way, it's the outcomes and the impact you make from the work. But if you just have a look at the value of the charities itself, it's probably about 27 billion, which is 1.25% of the GDP. If you add in formal volunteering to that, you're probably doubling it to 2.5% of GDP. And then if you add in the value of the volunteering from a minimum wage and then the social value for that, it's more likely to be between 137 billion and 234 billion. That's bigger than energy, bigger than agriculture. It's probably about 10% of GDP. If we had to pay for all what communities do themselves, we'd be bankrupt. But we don't value it, and we don't invest in it. Well, we invest in very little into it. This is just a bit of information about the voluntary sector in Cornwall. We've got an organisation called the VSFO who oversee the development of the sector, and this was the last thorough surveys in 2013. There's about 4,500 registered charities in Cornwall, probably about 1,500 small community groups. And from there, we've got 22,000 employees. So even as a sector, it's quite big. Most of those employees are part-time, 2 or 3, 4 days a week. We also have the highest level of volunteering in the country in Cornwall, a higher tier, probably between 33 and 36%, compared to a national average of 27%. The turnover of the voluntary sector is 580 million, and volunteering is about 490 million. So you can see it is a big, big part of the sector. So we do all sorts of things, and I think hopefully Tracy from Age UK will be talking about some of the things she's doing as well in there. So this is not just us, this is about the sector in general. So we connect people, we do social prescribing, we look at gaps. So we're working very closely with Children's Family Services at the moment, looking at how community groups can do more for families, particularly those children who might be at risk, because families with children at risk tend not to trust social workers sometimes, because they see the statutory responsibility and my child might be under threat, they might be taken away. So we work differently there. The quote at the bottom was from Stanford. Going back to technology, for me, technology is a tool. Sometimes, if you question technology, you're treated as a modern Luddite. This is about people, and Tim at the start mentioned it's about people. There's also a lady called Susan Blackmore. She's a visiting professor at Plymouth, and she's done a lot of research on something called a team, T-E-M-E, which has taken Richard Dawkins' notion of a meme and is looking at technology trying to replicate itself. There's not a week passes where we get a technological solution to a social problem coming to us. Because people say, you know, it's everything technology. It's a tool. It's a tool about bringing people together. So we use social network analysis, which is looking at centrality of people within the system, the nodes, looking at their connections. Sometimes strong nodes are good. That's where you get the bonding capital, because it makes people support each other. But sometimes you want weak ties. You want people with different ideas, or else you get groupthink and you get scapegoating. So in terms of how communities connect across each other is vital as well. So part of that is understanding that those people don't live in isolation, they live in part of the community. They have behaviours which are necessarily could be underpinned by behaviours in other parts of that community. So unless you address the community, you can't change behaviours. So I think public health are aware of that as well. So this looks at all of those issues which affect someone's behaviour. The top two, beliefs, and I think we live in a world at the moment where belief is paramount, which for some strange reason, that we don't take evidence. We just, and I think it was Govis who said we're fed up with experts. I think we're fed up with experts predicting the future. I'm not sure there's any economists here, but we need experts to tell us where we're going and what is around that, so that evidence. So all of those issues on there impact on people's intention to do something and their behaviour. And then you also have the frequency of behaviour and habit. All of those really are underpinned by what's happening in their community. So when you go into a community, expect some individual to change without understanding why they're in that community, and some of the norms around that, the empirical norms and the normative values. You can have facilitating conditions. Some of it is legal. So why is smoking gone down, and why is people not dying from car crashes? Legislation. So you can put legislation in which changes behaviour, but the arrows going to my left, to the left, are really what a lot of the voluntary sector do, is understanding the actions and work we've got to do to influence those other things. What is someone's self-identity? What are their norms? What do they believe in? So they take time. They're big cultural shifts. And part of that is engaging the people as part of the solution. So you're not doing things to people, you're working with them and letting them create their future. So I quite like these maxims. It's about they will decide what their future is. They will then work with you, not in a sort of paternalistic way, but as an equal in terms of developing some of the solutions. And again, that's something the voluntary sector have been doing for years, which is problematic for government because they like little boxes with little funding. We just got some NHS funding now, and they want it to be spent and successfully by the end of March. You're thinking, sorry, what? Because that was budgeted in this financial year. Again, going back to leadership, we don't lead a a machine. We lead a very organic system which interacts. So therefore, we've got to develop different type of leadership. So it's not leadership which is from above. It's like, freeing leaders from below. And again, just finally, this is some work from Berkeley and Stanford in the US, looking at that different type of leadership and what it means for organizations. So we have a very, very rigid game-playing system at the moment, which is about who can get most from it. And when you're working in the voluntary and the public sector, it shouldn't be about that. It should be about how do we add more value to what's going on, and how do we benefit each other, because doing it together you have a much bigger impact than you will by just doing it alone.